Hi, I'm Dr. Elsa van Dieren. I'm a rheumatologist and I'm going to be talking about how do I know if I have gout. We started off with the video episodes 1 where we looked at what the cause is of gout. But now, how do you know if you've got gout and not some other condition? I think the first thing that's important is how common is gout? I mean, how many people are going to be affected by this disease? And we talk about epidemiology, so it's kind of really looking at the whole population and seeing who's affected. And first of all, it's a condition that really affects men much more than women. About 10 times more men will have gout than women, and there are various causes for this. And it's probably got to do with things like women's hormones and so on, but we certainly see it more in men than in women. We do see it in older women, but it's about 1 to almost 7% of the population will develop gout. And because of this, it's really important for us that people know about it, know how to diagnose it and know how to treat it adequately. And as I said in our previous episode, it's actually something that we're seeing more and more of, and so because of this, more people are affected. So what are the signs and symptoms of gout? How would you know if you've got it? What would you expect to feel if you have gout? We usually start with what's called an acute attack, and most people that have had an attack of gout will know that this is what it is. You get this really excruciating pain in one of your joints. It develops really quickly. You see that it's red, it can be swollen, and as I said, it's really sore. You feel that nobody can even come close to you. But even if you don't do anything, it actually goes away or resolves within a couple of days. And this is very typical of gout. It comes quickly, goes away again within a couple of days. It's usually in the joints of the lower limbs. It can be in other joints, but it's usually in what they call the podagra, which is the joint of the big toe closest to the foot, or in the ankles, can be in the knees, but as I say, usually the joints of the lower limbs. So you get this very sore arthritis or pain. It can sometimes, in fact, also be in other areas, like what they call a bursa, which is a sac. We can, for example, have the sac becoming involved around the elbow, or in other areas around the heels, places like that. And this goes away within a couple of days, then you feel absolutely nothing. Now, between all of these attacks, you feel nothing. You've got what we call, and the nice name for it is the intercritical time, where you have no symptoms. And as the disease progresses and you have more and more urate in your body, these attacks will become more frequent. They may become longer. They may affect more joints. And then you get to a time where you actually have what's called chronic gout, where it can feel as though you've got pain all the time, and the pain can really be bad, and it really can be limiting. You can feel that you can't do things, you aren't able to do the activities that you want to do. So it actually affects your limit of function in various ways. The other thing that's important about this is that, as I said, these crystals that cause gout, the urate crystals, cause inflammation in the joints, and that inflammation initially causes pain because it causes this inflammatory reaction, or if you looked inside the joint, this redness and swelling and so on. But that can cause damage to joints as well. So you need to, again, treat it so that it doesn't get to a stage where you've got damage which can't be reversed. In the early stages, everything's reversible. As the disease goes on, you can, as I said, have more and more attacks. It can become chronic. You can also develop what's called a tophus, and I'll show you more about this in a moment. And all of these things are part of the way this whole disease progresses. Now, how do you actually know that you've got gout? Now, what's called the definitive diagnosis, so in other words, if we want to say that's absolutely definitely gout, you would take a bit of fluid out of a joint and you'd look at it under a microscope and you'd see the crystals there, and the crystals have actually been engulfed by cells of the immune system, and that's, as I say, what the definitive diagnosis is. But in most people, you don't really want to go and stick a needle into a very sore joint. So what we do is we look at the so-called clinical picture, so the symptoms, the story of what's going on with the person that has this is the way that we make the diagnosis. The picture of somebody that gets acute attacks of this very painful gout, the redness around the area that's affected, the way that it limits itself and progressively gets worse, all of those factors are what we use to make the diagnosis of gout. What do we do further? Well, we can look at blood tests, but your blood tests show the level of urate in your blood, but that's not always accurate when you're having an acute attack, and we need to actually look at that only several weeks after you've had an acute attack, and only then will we see the accurate picture of what the urate level is in your body. So we can do blood tests. We also need to rule out certain things, and very importantly, we need to rule out that you don't have an infection in a joint. And one of the things that would happen then is that you'd really be feeling very ill as well. So it's not something that happens often, luckily, but it's certainly something that we need to rule out. And certainly other types of arthritis can start by looking like gout, but as I said, gout resolves very quickly, and other types of arthritis will probably just carry on. So that's one of the things that we use to differentiate between them. Other things that we can do to make the diagnosis or to tell you more about the condition is that we can use imaging modalities like, for example, ultrasound, where you can actually see the collections of crystals in the tissues or in the joints. And you can even do scans. This is a thing called a DECT, and it shows very vividly where all the crystals are in the joints. So that's how you would know that you've got gout. And in our next episode, we're going to be talking about what should I do if I have gout.